Hi, I'm Vice Mayor Linda Bartz, and I'd like to welcome you to another edition of Helping Hands. Today, I'm very fortunate to have a good friend and a new friend on my show. Today I have Sydney Liebman from the Hands Clinic of St. Lucie County. Sydney's the old friend. We've known each other for a long time. And I have Derry Bonner, and she's with Premier Business Solutions. Do I have that right?
Premier Business Alliance of the Treasure Coast.
Okay, I was close, but I get it. So thank you for being here. Want to talk first, Derry, a little with you, and I'm not even going to try that big long name. I'm going to go with Premier Business Alliance. Tell me a little bit about what you do.
Okay, the Premier Business Alliance is a group of local healthcare businesses, small businesses, and we basically are sort of an exclusive club or a mini chamber of commerce that's devoted to healthcare services. All of the folks that are part of our group, basically we're trying to get into the healthcare industry and get in front of doctors and hospitals, CEOs, and that's kind of tough to do. So we kind of developed this little, I don't know, you can call it a club, I guess, but of folks that would be able to go into the community, be able to get in front of the medical societies and things like that. We've developed a lot of really good partnerships with some business groups in the area, and we basically do service offerings and are just in healthcare consulting, banking, healthcare furniture. We even have some folks that are do house office cleaning, that type of stuff. So it's kind of a broad group of people, but our main focus is basically healthcare and the healthcare industry and in the community, the local community.
So it's a broad base of people, but they all have their specialties that help the medical community. Do
That's
I
right.
have that right?
Yep, that's right.
Okay.
That's right.
That's great. I'm gonna talk about how we blend together in a minute. But Sydney, I know we've talked before. Let's talk about hands.
Let's talk about hands.
I was at a council meeting last night, had the opportunity to talk about the fact that you were going to be here, was around with Roundtable when they were showing us on video some of the children who needed dental care so desperately, and there are so many people being serviced by hands. So I'm going to leave that and tell me a little bit more about it.
Okay. A little bit of history. In 2006, some folks got together and decided to advocate for a healthcare clinic to be opened in St. Lucie County that would serve the needs of the uninsured population of the county. In 2010, the clinic opened, and when it opened, there were approximately 43,000 uninsured adults in this county. Today, 2015, there are over 65,000 uninsured adults living in St. Lucie County who need health care. Right now, our patient population at the clinic runs at a steady 3,500 or so. Some folks drop out because they've been able to get employment with benefits, and then we add new patients in. Our maximum capacity based on where we're located and our number of volunteers and so on is about 4,000, so we could take on a few more new patients right now. We are expecting an influx soon. Unfortunately, because of the closing of QVC, we're expecting about 500 more folks that will qualify for services with the clinic. That being said, our funding was dropped this year when the LIP funding, the low income pool of funding that has traditionally come to us, this year all of it was put towards hospital indigent care. A very small amount was put into the budget for free and charitable clinics. That funding isn't going to be available for a little while. Our previous funding expired June 30th, so we have been at risk, in all honesty, of closing. But we've been out there raising as much awareness and as many dollars as we possibly can in order to stay open and serve the needs of this community.
Do I remember that the doctors give a lot of their time?
All of our physicians, all of our dentists are all volunteers. We have volunteer nurses, volunteer hygienists, medical assistants, and so on. On staff, most of the staff that's in the clinic is clerical staff, and then we also have 2 nurse practitioners, so that we always have someone there that can help a patient. We also use third-year residents out of St. Lucie Medical Center. They rotate in, I think it's every 6 weeks, a new resident comes in and one leaves. We have an opportunity to use dental residents out of a university in Brooklyn. Unfortunately, we can't do it just yet because we also need a full-time dentist on staff in order to do that. And right now, all of our dentists are volunteers because they're practicing. So,
it is amazing that this clinic came from nothing, a need, and that a group of people got together and realized the need that was here and brought it to this point. But now, it's done fabulously, but now we need to help get it funded.
we do. It's a huge impact on this community. I could probably go on for hours about the true impact that the clinic has on this community. And one of the very most important is the fact that our 18,000 patient visits that we've had over the past 4 years, those folks could have ended up at a local emergency room. The cost of going to an emergency room is $5,500 locally, the 3 hospitals here in St. Lucie County. That's the average cost. So when you multiply that times 18,000 visits, that's $99 million of uncompensated care. You and I end up paying for that by way of increased hospital rates and by way of increased insurance premiums for those of us who have health insurance. So it's a huge impact just from that standpoint. A healthy environment, a healthy community, you as a council person, you are able then to entice businesses to come and open up here. But if our community isn't healthy as a whole, it makes it very hard for our government officials to do that part of their job. It's a huge impact all the way around. And as you mentioned earlier, the children that are served by our pediatric dental program, right now we have over 6,000 children under our care. We have a hygienist that goes into the schools and does dental checks to make sure that these kids are properly cleaning their teeth, and we provide them with toothbrushes and toothpaste, and many of them have never seen a toothbrush in their lives. So it's just imperative that we keep as many folks as healthy as we possibly can in order to continue to keep our community healthy.
And I don't have to tell you that I focus on the kids, and mainly because these kids who have teeth that were literally rotted out of their mouth, how do they study? How can they eat properly? How can they do? And they need that so that they continue to grow and be productive and be those people in our community that we want to be able to take care of.
Many people don't know that the #1 cause of missing school is dental issues. Nationwide, 51 million hours of school time is missed because of dental issues. And in adults, dental problems lead to heart disease. One of the highest reasons for heart disease is dental issues, and that's something that most people don't know either. So we're doing all we can. We have a waiting list for adults. We have a waiting list of over 500 people who need dental care right now. And our volunteer dentists come in on Fridays. So we chip away at the list, but it's always added to as well.
Sure.
So if anyone out there would like to volunteer their time as a dentist, we could sure use you.
You're going to do the background check and stuff, right?
Yes.
Just checking.
Yes.
Just checking. So, we're sitting here, we're talking about Hands Clinic definitely a part of the medical community. We're talking about Premier Business Alliance, those specialties, the Chamber of Commerce of the medical field. Let's talk about what's the connection.
How did we get together? Part of our goal in the PBATC group is to develop relationships with folks in the community that are impactful, like the chambers, the Economic Development Council, the Small Business Development Center, the Corporate Training Institute at IRSC, a lot of those groups that our members didn't know a lot about. And when we started the group, one thing that we really wanted to focus on was having a group that we could do fundraising for in our community. And so that's how we actually met Hands. We had met with them probably a year into having our group. And but Sydney wasn't there yet, and we did a follow-up a couple of months later because we were kind of in the beginning stages of developing our group as well. It took us about a year to really kind of get our name out through some events that we're doing for education and things like that. So when we went to meet Sydney, we let her know that any of the events that we would do to provide CEU credits in the community, education opportunities, any of the providers that we got involved with, some socials that we wanted to develop. We wanted to have one fundraising group that we could work with, and who better than a clinic that offers the kind of care that they do to the community in need. So we met up with Sydney, and the events that we do are either the socials that we do are exclusively for Hands to do fundraising, and we have 2 education shows that we do a year to provide credits for the local community, and part of the proceeds of those shows also go to Hands to help do fundraising for them.
How often do you do the socials? Once a year?
The socials are quarterly.
Okay.
We actually just had our first social, and it was a great success, and we do that at local community businesses as well to get people introduced to some of those. Our first one that we did was at Vine and Barley over in St. Lucie West, and it was a great event. A lot of people came out for Hands and helped to do donations, and so we're going to be having another one in August, I'm sorry, in August, and we'll have the word out on our website in regards to how to get involved also in those fundraising events that we do.
Good. And we've got your website on the screen, so people have got it as well as yours. So you basically decided, there are people that will say that your group is small. But small is all relative. I think that from the specialties I've seen, you've got a good-sized group there, and there appear to be a working group. So you have been lucky to be adopted by a good family.
Very good.
If we want to, and the thing is when you went to Sydney, it was before the funding was an issue.
Correct.
So what a great match. I would love to know about the socials. Sydney, you've got my full support. Hands Clinic had my support, I hate to say this, prior to you, but it's great that you are on board. I hear your passion. Can we talk just a little bit? You may not want to, but I have to ask you again about Julia.
I'd be happy to.
I know, and Julia is not a person.
Julia is not a person, but she does have her own Facebook page.
Yes.
Julia is a diamond necklace that has been donated to us by G. Allen Fine Jewelry, and he's located on Midway Road, and he heard us talking about a book that's out called The Necklace. The book is written by Cheryl Jarvis, and it's a true story about a couple of women who were shopping. They saw this diamond necklace, and they fell in love with it, but they couldn't afford it on their own, or even the 2 of them together. But they couldn't get it off their mind, so a few days later, they thought, well, why couldn't we get a bunch of us together to buy the necklace together, and then we'd all own it, we'd share, and it would be a wonderful thing. So they go to the jeweler, they tell him what they're doing, and he says, you know what, I'll even come down on the price, but you have to add my wife to your group. So it ends up being 13 women. He comes down, way down on the price, and they share the necklace. The book is actually a story about friendship and love, but anytime women get together, there's going to be a little more than friendship and love, and there's a lot of rivalry, a little bit of combativeness, some competitiveness, but it's a fabulous book, and it's a very short story, and I've heard through the grapevine they're even making a movie out of it. So Wendy Dwyer was the first person who told me about the book. She goes, read it, and you're going to see we can turn this into a fundraiser. And I did, and we did. And so we have 13 local women who each share ownership of the necklace for a month. They each bought into it for $1,000, and they also signed a contract saying that they would hold an event at some point during their month of ownership that would gather folks together so that I would be able to come and talk about the Hands Clinic. Because what I learned early on is the general population of St. Lucie County is not aware of the clinic. And so how can I expect anyone to donate to a cause that they don't know about? So we've spent so far 4 months touting and singing the praises of Hands, and I have so far been in front of over 8,000 people, and out of that 8,000 people, less than 400 already knew about the clinic. So it's really been a fabulous, fabulous opportunity for the clinic and for me to get to know even more people in this community.
Well, I have to tell you, I have seen the necklace, and it is gorgeous. And Greg from the jewelry store, old friend of mine as well, did a fabulous job. Where does that go?
A good question. So the ladies who own it are the ones who have to decide ultimately what's going to happen with the necklace at the end of the year. I get the feeling that none of them want to part with her, but I also have a feeling that she will be auctioned in May at our annual dinner. But that's not engraved in stone yet. So I don't have an actual answer for you on that.
So in the meantime, we get to run into friends, run into people, and see this gorgeous necklace. And you know, when you ask about it, you get to hear about Hands as well.
Exactly.
So what a different concept.
It's genius.
You know,
it's pure genius, isn't it?
we have done so many things. You and I go way back in doing fundraisers and things like that. This is just phenomenal.
It's opened a lot of doors.
So I'm
Yes.
very, very excited.
Thank you.
So I want to thank both of you for being on the show today. Are your socials open to the public?
They are. Our socials are, actually our events are as well. We have a health education trade show that we do 2 times a year.
Okay.
And we have one coming up on September 12th. It's going to be at Indian River State College at the Kite Center. And that's open to the public as well. But the goal with that, and Sydney will be there as well, part of the proceeds of that also go to the Hands Clinic. But what we'll be doing is, what kind of makes those trade shows a little bit different is we do CME credits, CEU credits, nursing credits. All of the folks that work for local doctors' offices or hospitals are able to get their certification credits within a year at only 2 events a year. And it's a very good price. You can find out more about that event on September 12th. It's on a Saturday. Breakfast and lunch is included. If you tell them about food, they will come. But it's really a great opportunity for local folks to be able to get their CEU credits without having to go out of town and things like that. Even doctors, because of the fact that we get continuing medical education as well. So we'll be having that, and that's going to be a really important event coming up.
Good.
We have it twice a year in spring and in fall.
Okay. Okay. Well, that's great. And you benefit, the doctors benefit, the community benefits.
Right.
I don't see the downside on this one.
Win-win-win.
Yeah.
I think that's great. So I want to say thank both of you. Sydney, it's always a pleasure. Dory, I hope that your mom is watching
Watching.
and is saying, yeah, that's Sydney and that other lady, and that's okay. But that's what makes our community what it is. So I want to thank you very much for being here this morning.
Thanks, Linda.
Thanks for having us.
Please stay with us. We'll be right back with more Helping Hands.